to today's update on COVID-19 in New Brunswick. Bon après-midi tout le monde.
Welcome to today's update on COVID-19 in New Brunswick.
On behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dominic Carty, Minister of Education and Early Childhood Development.
Speaking on behalf of the province today are the province's Chief Medical of Health Officer, Dr. Jennifer Russell, and Dominic Carty, Minister of Education and Early Childhood Development. Dr. Russell. Good afternoon, everyone.
Good afternoon, everyone. When you have been on a long journey, as we have been throughout this COVID-19 pandemic, it is natural to be focused on getting to your destination. But we should also consider what life will be like once we get there. COVID-19 will not disappear overnight. It will still be with us for some time. There
are going to be outbreaks. New variants could make their apparition. Resuming travel on the international scale as previous to the pandemic is going to provide the virus new opportunities to spread.
So even when we have our population fully vaccinated, the virus will still not go away. We do know that globally, there are countries that will lag behind with respect to vaccinations. And as vaccination rates rise here in Canada and in New Brunswick over the summer, we do expect the number of infections will decline. Outbreaks will be smaller and easier to control. Now, all that is relative. In Atlantic Canada, we've been really fortunate to keep our case numbers low, comparatively speaking, to the rest of Canada. So the difference won't be as dramatic compared to other provinces who've had very high numbers of cases and negative outcomes. Moins de gens.
Fewer people are going to become seriously ill in our healthcare system, and we'll be able to take care of these cases. Our objective was always to manage COVID-19, to protect our healthcare system, and to reduce the threat that this virus poses for the people of New Brunswick. And that will be possible with our vaccination program.
Threat will not disappear entirely, but we will be able to live with it. And again, key to our success will be our level of vaccination moving forward. For the present, we are focused on staying the course. Getting New Brunswick to the green alert level in our recovery plan will take longer and be more difficult if we fail to keep on the path that we are on. We must all continue to follow public health guidance and advice, with particular attention to those actions that limit the spread of the virus. Washing your hands regularly and thoroughly is very important right now. It's also a good idea to use alcohol-based hand sanitizer between washings to remove any viruses that you may have picked up. Wearing a mask, wearing it properly, maintaining 2 meters of physical distance, staying home when you feel unwell. All of these actions will help us to stay on our course to a more normal life.
It's equally recommended to use a disinfected hand sanitizer to eliminate all trace of the virus that you may have picked up. Wearing a mask and wear them correctly, and by maintaining 2 meters of physical distance, staying home when you feel unwell. All these actions will help us to stay on our course to a more normal life. Today, Public Health confirms that there are 10 new cases of COVID-19 in New Brunswick. There are 6 new cases in Zone 1, that is the Moncton, Southeast New Brunswick region. These 6 cases are contacts of already confirmed cases. In Zone 3, that is the Fredericton and St. John River Valley, there are 4 new cases. 3 of these cases are contact of existing cases, while the other one caught COVID-19 following a travel and is isolating outside the province. We're also reporting a single case of community transmission in Zone 3. That is a case for which we have no trace to another confirmed case in the region. This situation is concerning because so far we have been able to link virtually all the active cases in that zone. We believe this case is of a different strain, that is, and not related to other cases of COVID-19 now present in the Fredericton area.
Confirmed 10 new cases of COVID-19 in New Brunswick. In Zone 1, which is Moncton and Southeast New Brunswick, there are 6 new cases today, and all of these are contacts of previously known cases. In Zone 3, which is Fredericton and the St. John River Valley, there are 4 new cases. 3 are contacts of existing cases, and the other is a person who contracted COVID-19 through travel and is isolating outside the province. We are also today reporting a single case of community transmission in Zone 3. This is an infection that we cannot trace to other cases in the area. Now, this is concerning because to date we have been able to link virtually all the active cases in that zone. However, we do believe that this case is a different strain and not related to the other cases of COVID-19 now present in the Fredericton area. We now have 134 active cases of COVID-19 in New Brunswick. This includes 10 cases currently outside of the province. There are now 6 New Brunswickers in hospital due to COVID-19, including 2 individuals now in intensive care. And this includes 1 person hospitalized in another province. All New Brunswickers dealing with the impact of COVID-19 include more than 1,100 people who are self-isolating at this time and who need your support. I ask that you continue to keep them in your thoughts and prayers as you go about your day. Our vaccine program continues to gain momentum. And while we remain focused on getting a first shot into as many New Brunswickers as we can, as quickly as we can, we are also moving ahead with second doses in priority groups. We have prioritized second doses for residents and staff of long-term care homes because we have seen how vulnerable people living in these settings can be to this virus. Je suis heureux.
I am happy to announce that we're going to conclude later this week the second dose clinics for all nursing homes and special care homes in New Brunswick. I am convinced that the residents and their families are going to really be relieved knowing that they're going to have a higher level of protection against the COVID-19.
That we will complete second dose clinics for all of New Brunswick's nursing homes and special care homes later this week. And I'm sure that this will be a relief to residents and their families, knowing that they have the maximum level of protection against COVID-19. I would also like to remind those who had the AstraZeneca vaccine as their first dose earlier this spring that there is an opportunity to receive a second dose before the end of this month. And while we are not using AstraZeneca as a first dose for the general population, we will continue to use it for people over 55, particularly those who are unable to get a vaccine at an RHA clinic or pharmacy. We still have a supply of AstraZeneca vaccines that will expire at the end of this month. So if you are over the age of 55 and had this vaccine as your first dose, you can immediately receive a second shot from this supply. You can register online for a clinic offered by Horizon or Vitalite Health Networks or through a participating pharmacy. If you decide to wait for another product, you will have an opportunity for your second vaccine within 16 weeks of your first shot. Public Health is awaiting guidance on which products are most effective in those circumstances. We now have more than half of our population with at least 1 dose of a COVID-19 vaccine. In the weeks ahead, we will be providing second shots that increase the level of protection. As the level of protection goes up, the level of restrictions should be able to decline. And as you know, in New Brunswick and Atlantic Canada, we've had really stringent measures in place throughout the pandemic. And as we get more people vaccinated, the bulk of the work will really be being done by the vaccination itself. So even when we get to the green level, the virus won't disappear. We will still have to look out for ourselves and care for one another. Cette pandémie nous...
This pandemic has taught us many lessons, but none greater than this. We have a tremendous capacity for kindness and caring that will enable us to get through difficult times.
Many lessons, but none greater than this, that we have a tremendous capacity for kindness and caring that will enable us to get through difficult times. We will have the strength to call upon whenever we need it as we continue to live with COVID-19. Thank you very much.
Good afternoon, everyone. Bon après-midi.
Good afternoon and welcome.
Last night, we did have a third positive case of COVID-19 confirmed at Priestman Street School here in Fredericton. And as usual, the school community was notified. Public Health has directed students, staff, and their families to extend their self-isolation period until 11:59 p.m. on Friday, May 28th, to allow for contact tracing to be carried out. Students will engage in distance learning for the remainder of the week. While I know that anxieties are high in the Fredericton area, I want to reassure families and let them know that no in-school transmission cases have been determined in connection with these three cases. Last night, we also heard that a possible exposure to a positive case of COVID-19 was confirmed on bus 210, carrying students to Fredericton High School and to George Street Middle School on the mornings of May 18th, 19th, 20th, and 21st. So any students who were on bus 210 on those mornings between May 18th and 21st and their families have been directed by Public Health to self-isolate for 72 hours as contact tracing is carried out, and then to self-monitor for 14 days. We are strongly encouraging students and staff at Priestman Street School and students who were on bus 210 to get tested over the next few days. I know that many families have had questions as to why we've had different responses as a system to different cases in different schools and in early childhood education centers over the last months, over a year now. And the answer there is because each situation is different, each school is different, and every time that we see a case, we try and deal with it appropriately based on those specific circumstances. So our outbreak management plans, which have been developed to minimize the risks to students and staff and to support contact tracing, have been designed tailor-made for each school, and each time an outbreak hits a school, the response is tailor-made as well. So what that means is that when Public Health evaluates each situation on a case-by-case basis, and then they undertake calculated risk assessments and determine the best course of action. And this has so far proven to be very successful, thanks to the work of the contact tracers, thanks to the work of the folks at Public Health and at EECD and at the Department of Health, and all the other folks who have helped out over the last year and a bit, and the citizens who followed the rules that Public Health has laid down for all of us. We know that school is incredibly important for our students, and we want to make sure that we can, to the greatest extent possible, minimize the disruption to the day-to-day lives of our students. So we know that there are lots of kids who are depending on the programs that are provided that are in schools to make sure that they can stay healthy and happy and safe. And that's our goal as well. So, as always, there will be no hesitation from my part to close down schools should the need arise. But our back to school plan, our return to school plan, which was put in place last year for the whole province, was developed to keep schools open and safe, even when a small number of cases were confirmed. Now, saying that back, I think it was about a year ago now, so we have to expect more cases. We have to expect some serious cases. This is always about managing a pandemic, not keeping it completely away, although we've done a great job as a province in doing just that. So similarly, our return to school plan was designed to align with Public Health's alert levels, and we're going to continue to follow their advice and work with the schools and the districts for the last few weeks of this school year. And it's another opportunity there, which I'll take to really thank the school, the district, and Public Health staff for reducing the impact on our school system over the last days. We have only lost 28 operational days in 48 schools across this school year. And that's a record that is unparalleled in most of the world. And it's because all of those folks I just mentioned, and the students, and the parents, and the people who support those families also did the right thing. And that's let us have as close to as possible a normal school year for our students in the face of a pandemic that in many parts of Canada has shut down schools for weeks or months. Sometimes schools closed for months and then reopened again the next day for a single day and then closed again. This happened in the UK earlier this year. So we have a lot to be thankful for, and I'm incredibly grateful to all of those staff, bus drivers, custodians, and everyone else for the sacrifices they've made, the extra work that they have put in to keep our students safe. Remember, as always, if you've got a family member or if you've been identified as a close contact, Public Health is going to be in touch with you directly as part of contact tracing. So please follow the directives that they give you and remain vigilant and be ready to answer your phone if public health calls. Actually had someone emailing me about this, asking if public health's number came up on the screen. So yes, please do answer your phone when public health calls you. So have your ringers on if you're at all worried, and hopefully, again, this next few weeks will be the last time we have to worry about these sorts of things, and we can go back to ignoring our phones as usual. If your phone doesn't ring, that's good news. Aujourd'hui,
Today, I have the great pleasure to share with you good news, which are going to bring about a more normal school year when the students are going to go back in September. Since a greater number of vaccinations are available in New Brunswick, we are broadening as soon as now the people who are eligible in New Brunswick for the ages of 12 to 17 years. Youths of 12 to 17 years of age can take an appointment to receive the Pfizer-BioNTech vaccine. For youth less than 16 years ago, parents' consent or a guardian will be required.
those aged 16 and older, or the parents or guardians of someone aged 12 to 15, can register for an appointment at a participating pharmacy or through the clinics provided by the Vitalité or Horizon Health Networks. And you can book your appointments online at www.gnb.ca/book-a-vaccine, all one word. If you can't book online, couldn't understand what I was just saying, you can call 1-833-437-1424. 1-833-437-1424. S'il vous plaît.
Please be patient because the vaccines are coming progressively and availability for meetings can vary. More appointments are going to be available next week or the week after.
Very hard to support public health and their plans to vaccinate children 12 years of age and up, and to ensure that their families are well informed. And in the coming days, our province's 7 school districts will be sending out information that will help guide parents through the registration and vaccination process. And our goal is to provide parents with efficient access to information so that much like the vaccine, the registration process is quick and painless. We know lots of people have been curious as to why we're taking this approach instead of vaccinating children in schools. And I can say that was certainly the first question I asked. We did look at lots of different options, but because the Pfizer-BioNTech vaccine is the only one currently approved in Canada for use in children as young as 12, it presents a lot of logistical difficulty to have vaccine clinics in schools. It's a vaccine that, as of right now, has to be stored at very, very cold temperatures. Transporting it is difficult. And of course, we've got limited staff able to administer the vaccines, and a lot of those folks are already working on vaccine clinics elsewhere. So we looked then at busing students from school to their local clinic. But then we realized that every community across the province has so many different challenges that would again present a logistical challenge that would outweigh the benefits. So to ensure that we're working as hard as we can to support public health and making sure their resources are allocated as efficiently as possible, we decided we did not want to fragment them or impose a blanket approach. Comme nous savions que
As we knew that parental authorization are going to be required, in any case, we invited a parent to join their students when they're coming in for their vaccination. That way, a parent is going to be on place for all the necessary information, and we will be able to minimize the number of meetings that are going to be missed or lost authorization sheets.
strongly encouraging that a parent who is yet to be vaccinated go in, get your shot at the same time as your child. Show our children that they have a chance to play an important role in getting our province back to pre-pandemic life. Because the sooner that our population is vaccinated, as Dr. Russell said, the sooner we can return to normal. And that includes returning to a more normal school year. We all want schools to be able to return in September with the same openness for sports and activities, friendship and togetherness, end to distancing and end to masks, end to the restrictions that we're all fed up with. And getting vaccinated, important step towards us achieving that goal. I do understand that there are concerns as well around children under 12 who cannot currently access any of the available vaccines. Hopefully that's going to change as the science around the vaccines accelerates, but it's yet another reason why it's so important for all of us who are able to get vaccinated to go and get that shot. And we've seen New Brunswickers taking up that challenge with incredible enthusiasm, and it makes me proud to be a citizen of this province. But please, parents, grandparents, guardians, book an appointment for your child. Get them vaccinated to protect them and to help protect our schools and keep them healthy, safe, and open.
Vaccines are going to contribute to protect you and the people close to you. The more people that are vaccinated against COVID-19 is higher, more difficult for the virus to spread. This will allow to preserve or keep lives and to obtain an easing up on restriction.
Being able to reach this point in our vaccination rollout by late May, it's something, again, that we should all be proud of. It's a testament to all the hard work that's been going on behind the scenes. And again, want to repeat my thanks to everyone who's helped make that happen. We have incredible staff across the province who've come together and pitched in, and they've helped get us here. Alongside all of you watching or listening, who've done your part as well. Our nurses, our pharmacists, public health workers, working just endless hours to support this rollout. So for everyone who signed up, rolled up their sleeve, gotten their shot, thank you. By working together, we are protecting our loved ones, our communities, and our province. So let's make 2021 a year that we will never forget, hopefully never repeat. Let's make it a year that we won't forget, though, for some of the right reasons. Let's think to the future. Hopefully just a few weeks, most months from now, we can take off our masks, hug each other again, go to live concerts, enjoy music, enjoy being outside, and let's never again take for granted some of those freedoms that we've had to be seen restricted over the course of the last year and a bit, for all the right reasons, but hopefully never again. And let's also not never again take for granted how beautiful our province is and how much we value our friends and neighbors.
We're almost at the end. We cannot slack down now. Please, as always, follow the advice of public health. Help contact searchers by noting where you went, wear your mask, and once again, wash your hands and keep your distances.
We can push through this just a little bit longer, long way down the road, and the finish line's in sight. Thank you. Merci.
Monsieur le Ministre, Dr. Russell. Now proceed with questions from members of the media. Each reporter will have 2 questions. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. We'll
now proceed to reporters' questions. You have a right to ask your questions in the official language of your choice. Each reporter is going to have 1 question and a follow-up question. Please mute your mics. Tim Roselle, Global News.
Thank you, Bruce. My first question is for Minister Carty. Mr. Minister, if the information about the vaccination process is going to be sent out by school districts and families over the next little while, and if the plan is to not vaccinate students in schools, what is that information going to contain?
Well, it's going to contain information about exactly how you can access the vaccines. A lot of the information that I just gave out in terms of here are your options for using pharmacists, for using the clinic set up by the health authorities, information as well on consent forms and how you can access those. So just the basic information that you would need to help you. I could compare it perhaps to the voter cards that get sent out, telling you where, when, and how. And the goal there is to have everything in one place for parents so they can quickly get themselves and their children vaccinated if they haven't had their shots already.
Second question, Mr. Roselle.
Thank you, Bruce. My follow-up would be to Dr. Russell. Dr. Russell, does anything change at vaccination clinics, be they at a pharmacy or one of the RHA clinics, now that you're going to be in a situation where you have parents coming with their children to vaccination sites? Does anything change at those locations, just logistically or anything like that?
Not that I'm aware of. I mean, the physical distancing will still happen, and obviously a parent with their child, they're in the same household bubble. So they would be able to stay together, I'm presuming. I do have a correction to make. There, in my notes earlier, I referred to people getting the second dose of their AstraZeneca vaccine. They can register to get their second dose if it has been at least 8 weeks from their first dose. That wasn't clear in my speech. And just coming back to the protocols around the vaccine clinics, whether it's in a pharmacy or an RHA clinic, making sure that, again, all the protocols are followed properly, being properly masked, and making sure that you're social distancing appropriately.
Thank you. Thank you, Mr. Roselle. Thank you, Doctor. Thank you, Minister. Alexandre Boudreau.
Alexandre Boudreau, Acadie Nouvelle. Good afternoon. My question is for Dr. Russell. I'd like to know if you received the result of the Thibon Soin results, results of the test, if you have any other information on the outbreak since yesterday. About the situation at the nursing home that you mentioned, I know that there is one positive case, and those are all the news that I have. Our prompt team is there, so they're going to do all the things that they do every time there's an outbreak in a nursing home, with the cooperation with the employees and staff, the families, the residents, and Red Cross, etc. So they're all going to work together to protect all the residents. Mr. Boudreau, you have a follow-up question? Second question, rather? Yes. Well, that's it for Mr. Cardy or Dr. Russell. I'd like to know if the vaccination against COVID-19 is going to be added to vaccines that children must have when they go back to school for the first time, as is the case for tetanus, polio vaccines, etc., whooping cough, etc. Merci.
À ce point, on n'a pas l'intention.
At this point, we do not intend to add it. I'm anxious to return for the program for vaccinations in school in September, but once again, that vaccination is not on that list. So we have a list of compulsory vaccines for students at school, and against COVID-19 is not on that list at the present time. We've seen a lot of support for the vaccination program during the past week by Public Health. It's something that I'm really proud of our province, and I hope that it's going to continue in the same vein, and that the question of doing something compulsory is going to be irrelevant due to the fact that the majority of our population supports the vaccination system and have received their vaccines to protect not only themselves, but their communities and their families. Thank you, Mr. Boudreau. Thank you, Mr. Minister.
Savannah Odd, Telegraph Journal.
Hi there. Dr. Russell, you had mentioned the community transmission case, and you had said it was a different strain from the one currently circulating in Fredericton, which I believe is the India variant. Could you clarify which variant this community transmission case was? And do you know how many close contacts they had, or contacts, I guess, in general?
Hi, Savannah. As of right now, the genetic sequencing that was done, I'm not sure whether it's actually the B1617 or a different variant. I'm not talking about the variant here. I'm just talking that it's a different genetic sequence than whatever is circulating currently. And I don't know about close contacts at this point.
Follow-up, Ms. Odd?
Wait, I'm sorry. So you don't know, I guess, which variant that one is? Sorry, I didn't. I'm not sure.
Right. Again, the information that I have right now is that the preliminary genetic sequencing that has been done already differentiates it from any of the circulating cases right now. That's all the information that I have. We will have more information on that. I guess I just wanted people to understand that we're not looking at a new case that has popped up that could be related to the cases that originated from the cluster at the Delta.
Right. Okay. And that is a different from the variants circulating in Zone 3, or for all of New Brunswick, and as well for Zone 3. If you could maybe just describe transmission patterns in the settings where we're still seeing a lot of transmission happening.
So just coming back to that community transmission case, I will have more information on that. Again, the only point around the genetic sequencing was just to let you know that we had made sure that it wasn't linked to the original cases from the Delta and the B1617 strain that we know is associated with those cases and their close contacts, which I think is upwards of at least 75, if not more cases by now. And so I don't have the information on the close contacts right now on that particular case of community transmission, but we will have more information on that. And your other question was around patterns of transmission around the province. That's your other question. I can just say that we in the zone 1 that a lot of the cases that we were seeing there were the UK variant, so B117, and that's really all the information I have on the different variants right now. I do have some positive news, though, about Fredericton in Zone 3. The McGee House outbreak is declared over today by the Regional Medical Officer of Health.
Thank you, Ms. Ott. Michel Corriveau, Radio Canada.
Yes, I have a question. A follow-up for Alexandre, for Mr. Cordy, or compulsory vaccination. I'd like to know if the minister is what percentage you expect vaccination in the students so that it won't be necessary to make it compulsory in the schools in 2021. I thank you for the question. It's not a case of a percentage that's going to be compulsory or not. There's no plan for making it compulsory at the time being, but we hope that with our target to have at least 75% of the population vaccinated, I hope that we can increase that with the youth that are vaccinated and member of the school teams as well. After fun, we had very incredible results. I believe more than 90% for the school teams at the high school level that was offered vaccination. And I hope that we can continue by using that same percentage as an inspiration or an objective. Corriveau, do you have a second question? Thank you, Bruce. Yes, I have a second question. Probably for Minister Cardy once again. In the case of the 210 bus that transports students and for FHS from Hanwell, if I'm not mistaken, have any steps been taken from FHS in that case? I'd like to point out that it was FHS and George Street, not FHS and Priestman. I don't want to worry the team at Priestman. It's the 3 schools with their students. I believe I've worried them enough in the 70s and 80s. So, and for the youth who were on the bus, as always, wait for the public health contacts. And if you're being communicated from public health, it's for a reason. There are 115 students who received a letter. The families received a letter to inform them that there was a risk of contact and just to follow the advice of public health as always. It's simply a school, it's just a classroom on wheels, so it's the same policies exist for contacts as in an outbreak in a school. Thank you.
CTV.
Good afternoon. My first question is for Dr. Russell. Could you please tell me the percentage of long-term care residents in Brunswick and how many residents and staff in New Brunswick have been vaccinated?
Allison, please.
Sorry, what's the percentage of long-term care residents and staff that have been vaccinated to date?
I'm just looking for that information right now.
And if you're perhaps, while Dr. Russell is
Sorry,
getting
I
that
did
information.
find it. Sorry.
You got that?
Yeah.
I have something else. Drop in afterwards.
Pardon?
I had something else on the public health
Oh, okay.
private line.
So my understanding is we have 68.8% of long-term care facility residents vaccinated. And 45.5% of long-term care staff have received 2 doses.
Sampson, do you have a second question?
I do. I'm wondering, do you also have the numbers of how many people, I might stop kidding, but how many people in zone 3 are isolating at the time?
Good. That's the latest number I have. 1,100.
Vicky Hogarth, CHCO, TV.
Thank you, Bruce. Dr. Russell, should children 12 and older with autoimmune conditions feel safe taking the vaccine?
On the product monograph, and there are contraindications, and some of those things parents can talk about with their primary care providers as well as specialists that are involved in their care. So that would be a decision that would be made with those types of conversations. But certainly at the clinics, the nurses are trained to ask questions about contraindications. So, but as of right now, those conversations need to take place with primary care providers and patients and specialists.
Follow up, Ms. Hogarth?
Thank you. And for Minister Carty, are young adults aged 16 and 17 able to book appointments for vaccines without requiring their parents' consent? What is when it comes to vaccines?
That's a great question. And yes, that's it. It's those students from 16 and up, they can book their own vaccine appointments and don't require any permission from anyone else. And I wanted to add something in from my statement earlier, because I think I was a bit unclear around answering the calls from public health. Answer those calls because they sometimes do come up as private numbers. So it's a good time to make sure that you do answer a call from a private number, even if that's not normally something that you might do.
Thank you, Ms. Hogarth. Thank you, Minister. Before we go to Bobby Jean, Savannah, Dr. Russell has one point to add.
With respect to transmission patterns, obviously close contacts who live in a person's household are at the highest risk. But because with the variants, we do see transmission happening before a case is actually identified, we do see transmission happening in workplace settings. We also see transmission happening in workplace settings if people are not wearing their masks properly or at the appropriate times. And we're also seeing transmission in workplace settings when people go to their workplace with symptoms instead of staying home and self-isolating and getting tested.
Thank you, Doctor. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell or Mr. Carty, I know you talked a bit about there being no student transmission, but do you have any information about how many COVID cases were contracted in schools and how many were contracted in home or elsewhere and brought to schools?
I do have some of that data here. Just give me 1 second. Had, if I recall correctly, 48 schools impacted by COVID, and not too many more cases than that. I think the most we've had in a specific school has been around 3. Well, I can get you the exact breakdown of all that in terms of the precise schools and districts and so on, just if that would be helpful. But so far, in addition to not having transmission inside the school, we've had just very good luck and good planning and good execution of the plan that have kept the case numbers in those schools really low, regardless of their origin. So hope that answers your question, and happy to get you the full list, which is obviously, because it's up close to 50, is quite a long one. So I won't read it here, but we'll get it off to you.
Thank you.
Ms. McKinnon, do you have a follow-up?
Yes, I do. Dr. Russell, what was the origin of the Delta cluster, and could you give the breakdown of the number you cited earlier I think you said we're up around 75 now?
So the
indirect.
So from the index case at the Delta, there were 12 people who were either guests or patrons or, sorry, there's a mosquito bugging me. Of the 12 cases directly linked to the Delta, to the Delta Index case, they were either guests or patrons or staff. And of those 12, those people have transmitted to close contacts, including household members, et cetera. And so the total number as of yesterday from that entire cluster was 75. But that number probably went up today because I know we had 3 new cases.
I'm sorry, did you say, I didn't hear, did you say what the index case was?
I can't really elaborate other than there was an index case at the Delta and that the index case transmitted to either staff, patrons, or guests. And that included
And
12
why?
in total.
Why can't you elaborate?
I'm trying to protect confidentiality while trying to not get bitten by a mosquito.
Thank you, Doctor. Thank you, Ms. McKinnon. Aiden Cox.
Good afternoon. With a second positive case confirmed at the Fredericton YMCA daycare, does this not qualify as child-to-child transmission?
I would have to look into that. Sometimes these cases are, every situation is different, so I can't confirm that. It could be that they were family members. They could have transmitted in a play date outside of that daycare. I don't have the exact details, but if we haven't said that there was transmission within that setting, then I can't confirm that. And I just need to correct some information around the long-term care staff that are vaccinated. So the 68.8% corresponds to the percentage of long-term care staff that have had at least 1 dose at this time.
Mr. Cardy, would like to add?
Could you maybe clarify the answer that you offered?
Hold on.
Repeat it.
Or which?
Just about the second positive case at the YMCA daycare and whether that meant or qualified as child-to-child transmission.
I can't confirm that because every situation is different and I am not aware of the exact details. If there was child-to-child transmission, again, I don't have that information and it would be difficult to confirm at this time. Sometimes the transmission is because the children know each other outside of the daycare. They could be family members, they could be neighbors, they could have had a play date outside of that setting. So I can't confirm that at this time.
Move on to your second question. The minister would like to add something.
Just in relation to the previous question again, just to make sure it's out there, is in addition to 48 schools, so we've had a small number which have had a couple of cases, as I mentioned, and then we've also had 14 possible exposures impacting schools since last October, and since September also 18 early learning and childcare centers that have also been impacted. And as the doctor had said, we've had multiple cases where we've had different people coming into schools who have had COVID-19, but they haven't transmitted the disease one to the other. So it's continues to be the reason why we want to try and keep schools open as much as possible, because they're well managed and the staff are well trained and everyone's committed to doing their best to keep those ECE centers and the schools as safe as possible.
Mr. Cox, your second question, please.
So we asked a couple of weeks ago how many COVID-19 positive cases we have here from other provinces. Have you been able to track down that number?
I believe we announced that on a day-to-day basis with respect to separating out which cases are actually here in New Brunswick and which ones are not.
Or discrepancies been clarified in the way this is being reported now?
Every day when we do either a press conference or have a press release, that information is contained in the press releases, is my understanding. It separates out which people are outside of the province.
All right, thanks.
Mr. Cox. That concludes today's update. Voilà la fin de notre mise à jour.
That concludes today's update. Thank you very much. Merci.